You Ethicuties and the 40% of you who have still not subscribed to the Ethicsverse, welcome to the coolest place to be every Tuesday at noon Eastern. Special Ethicsverse Healthcare Edition. We got a real treat for you today. So let's dive right in. Before we get started, as always, we want you to drop your LinkedIn URL in the chat. It's even more important, it's even more prevalent in the healthcare sector within compliance than the broader compliance industry. But this is such a collegial community that we're a part of. So connect with at least one person today, because again, you get no bonus points for reinventing the wheel, and your network is your net worth. Neither are big enough. So go ahead and keep building that network and take advantage of this amazing asset that we have. Today, we are going to be talking, you're going to really love this. We're going to be talking about navigating healthcare, the ENC and HR's guide to gaining better buy-in. So, you know, I love thought leadership. You know, I love all these podcasts that are out there. Encourage you to check at least a new one out. If you haven't listened to the FCPA Survival Guide, people are still talking about it. So that won a phenomenal award last year. Very prestigious, very top shelf award. So go ahead and check that out. And of course, the Great Women of Compliance podcast keeps rolling. We have a new episode of the Ethics Experts. This is the fastest growing podcast in the ethics and compliance space. Top 2% global podcast right here. I'm not bragging. Not my words. We had Todd Ha on. He is a professor, an ethics professor at my alma mater, which is Indiana University. So really great conversation, really interesting conversation, some great research that he's doing. So encourage you to check that out. We want to keep bringing that content to you guys and keep trying to add value, because what got us here is not going to get us there. And that's a lot of what we're going to be talking about today. If you are a healthcare professional and you're not doing business with Ethico, I think that you should, okay? Ethico is the only healthcare-based ethics and compliance company that's out there. And so, you know, people end up, you can change cameras, people end up coming to us for a number of different reasons. And we have a really cool promotion going right now. So I want to share this with you quickly. So Ethico is your promised land. And so if you want more speak up, we have 2 times the rate of risk intelligence. If you want a lower anonymous rate, we have 2 times the identified reports. You want more efficiency, you can close your cases 2 times faster. You want more manager participation. That is the thing. That's the key to unlocking this culture of integrity that you're trying to build. We have twice the manager reporting rate. If you want less abandoned reports, we have 15 times lower abandonment rate. You want better reporting, 10 times less Excel time. So if you're not an Excel nerd like I am and you don't like living in Excel, how about those reports are just done for you? You want a less expensive total cost of ownership? We have 15% off if you take advantage of our Promised Land promotion right now. So we can help you with your sanction screening. We can help you with your investigations, your issue intake, your disclosures, a whole bunch of stuff. So now that commercial's over, just drop my name and you'll get that 15% discount and up to a year off. Okay, we got some great prizes to give away today. This is Jay's new book. It is called Navigating the Politics of Healthcare, a Compliance Officer's Guide to Communication, Relationships, and Gaining Buy-in. So we're going to be diving into that today. And, you know, we usually only give away 5, but every time we have an author actually on, we're going to go ahead and double that, and we're going to be giving away 10. So let's give a nice round of applause for Jay. Let's see a ton of emojis. Nobody's had lunch yet. You know, that's what we sustain ourselves on right here. Also wanted to share before we dive deep into this, Jay has a really cool course that he's put together. So this is all about how you can sell compliance. And so the next one is coming up real soon. Check out this QR code and check out this course, because there's a lot of great, valuable information in there. I am Nick. How's it going? Great to see everybody. And this is the one and only Jay Anstein. Okay. So Jay has a tremendous background. He's a healthcare compliance expert. Worked in a lot of great big organizations, and he's really become, you know, he has a real knack for navigating the politics and real knack for navigating the landscape within healthcare. And he wrote an entire book about it. So we're going to be diving into some of those tactics and techniques today. Jay, how's it going? Welcome to the Ethicsverse.
It's going good. Thanks, Nick.
So as always, drop your questions in the chat, drop your comments in the chat. We want to work those in. And if you share anything from today's Ethicsverse episode, from this special healthcare edition on LinkedIn or on social somewhere, you're going to double your chances to win. So this book needs a home on your bookshelf. So go ahead and participate. All right. Jay, how's it going, man? Welcome to the Ethicsverse. I already said that. Okay, so let's dive into this presentation. Why don't you walk us through our agenda of what we're going to be talking about today, Jay?
Yeah, so a lot of what we're going to focus in on today is relative to one of the chapters in the book, which was specific to conflict and how do you use diplomacy to resolve conflict, because conflict is inevitable. within the workspace. And so I know, at least for those compliance professionals, conflict happens all the time on a day-to-day basis as you're trying to roll out a new regulatory change, or you're trying to work through an investigation or conduct an audit or something like that. And so that topic in and of itself felt like it was perfect to put within this book, and trying to help compliance professionals build better and stronger relationships with their operational leaders.
Okay, so we're going to kind of be covering three main areas today. We're going to be talking about communication. We're going to be talking about knowing the business, and we're going to be talking about building relationships with leaders, right?
Yes, correct.
Okay, great. All right, so before we dive into this, Jay, I think you've gotten a lot of really great feedback about the book. What do you think people are connecting with? What is it about the book that's really resonating with folks before we kind of start getting into the nitty gritty, the tactics that we're going to, dive into today?
Yeah, a lot of it has, I think it's been sort of, hey, not a lot has been written about this, or these are things that you learn through experience. And a lot of our newer folks just starting out, or people that are just trying to find their way, it's very valuable information for them, because a lot of what I wrote in the book, and I covered a lot of struggles that I had as I was moving forward, throughout my career. And so the reason I wrote the book was, hey, these are some things I kind of wish I would have known when I started out. And so that's really what I made kind of the theme of the book about is, if somebody was going to pick, I think I put that at the beginning of the book is, if you were asked me to go to lunch or grab coffee or something, you wanted to ask me about starting out in this type of work, what would you tell me? And so that's sort of what I used as a catalyst for the book. And so that's what has really resonated, is a lot of the insights through experiences and a lot of real conversations that I had in the book, because I was obviously being pretty vulnerable in sharing some of the challenges and struggles that I had in my career.
Well, that's really what resonated with me, Jay. I mean, it's written in a really authentic, you used the word vulnerable. I think that's right. It's a very sort of approachable book. And I think because you led with that authenticity, it's really easy to kind of resonate with the stories and see how they might apply to our own lives. So I really love it. I can't say enough good about it. We'll be giving these away at HCCA, of course, because we love giving away books. We don't even like selling software around here. We just like giving away books. All right, let's dive into the inevitability of conflict here. So when it comes to navigating healthcare, you spend some time talking about the inevitability of conflict. So walk us through this concept and what we need to kind of be aware of around this.
Yeah. So, I mean, the inevitability piece is just because, in the current state and hopefully for a while, organizations are run by human beings. And so we all show up to work with our own, opinions and motivations and things like that. And sometimes those align with other people and sometimes they don't. And so I don't think healthcare is probably unique. I think it happens in any industry, but at least in my experience, we'd run into it a lot when it comes to things like trying to roll out a new regulatory change to meet an operational process. And you have a group of nurses that are involved. You've got physicians that are involved. You've got registration staff or scheduling staff, or somebody each plays a part to complying with this new regulatory change. And everybody's got a point of view specific to their role. And how do you kind of work through that to get everybody on the same page, and so that everybody's got buy-in to the new process that they're going to have to live with?
Yeah, and I think the inevitability of conflict, I mean, it's kind of in the title here, but it's going to happen, right? Everybody has different agendas. Everybody has, different priorities, and many times it can feel like our agendas are maybe an imposition on somebody when we really need their buy-in in order for this agenda to actually, take place or to take root, I guess. So how important is communication in this, and what should people kind of keep in mind with respect to communication to kind of maybe get out ahead of this conflict that is inevitable?
Yeah, no, great question. And it is a very integral piece to this, because I think, and probably part of the inevitability of conflict piece is, at least in my experience, conflict usually happens because of either one of two things. Either there's misunderstanding or there's miscommunication. And there could be a whole number of reasons as to why that happens. But some common ones a lot of times is somebody wasn't involved in the process early on. They weren't aware of the fact that a new change was coming. Nobody involved them to get their point of view, or there just wasn't a discussion about something. And so people, what I would call, make up or make stuff up in their head as to what reality is, when it's a little bit different from what reality is. And so it's communication really is the cornerstone to trying to work through conflict and make sure that you're more over communicating than under communicating, and that you are talking with each side, as you're working through conflict. Or another common one that comes up is not closing communication loops. That a lot of times leads to conflict. Something happens, there's a meeting, there is something discussed. Not everybody that should be in the meeting was in the meeting, or somebody couldn't attend the meeting. And then somebody forgets to follow up with the person that really was a critical person to rolling out a new process change. And then it becomes a surprise, or it feels a kind of a gotcha moment to them. And so, what I always advocate for those is, try and anticipate those situations coming up. That helps avoid conflict. Closing those communication loops. I know, especially when it comes to hotlines and things like that, a lot of things that we preach is if you see something, say something. I think that's a very good concept that can apply when it comes to closing communication loops. And if you identify, hey, somebody wasn't in this meeting that should have been in this meeting, they really need to know what's going on, then either bring that up in the meeting and be assertive about it. Hey, who's going to connect with this person, because I think they really need to weigh in on it, or take the initiative to close that loop yourself. And a lot of times taking steps like that will kind of help avoid conflict from the beginning.
Yeah, that's good. I think that's spot on. So William put a great comment in the chat here. Conflicts have to be viewed. Hold on, I just lost it. Conflicts have to be viewed as opportunities to frame conversations to address issues faced by both parties. It takes a 360-degree view to bring it to resolution. Doing this is an art, and a good chief compliance officer can bring change without being viewed as the person that said no. So that really resonates with me, because we spend a lot of time on the Ethicsverse and in general talking about the importance of persuading and the importance of influencing, right? Very rarely can we walk around with the riding crop and the bullhorn and yell at people to get things done. They have to sort of voluntarily do the things that we want to get done. And I love how he put that. It's an opportunity to frame it. I mean, it's two things. A conflict is an opportunity, and it's an opportunity to frame. Yeah. And when we're talking about framing, we're talking about drawing a new box around whatever it is we're talking about, and trying to kind of connect and trying to understand, well, how is this initiative from my side going to get stuck, which I can never understand until I actually know what that person's reality is, and I actually know what their true agenda is and what their true priorities are. And again, that can't come from reading someone's LinkedIn page or their bio on Slack, right? That's going to come from getting to know that person.
Yeah, exactly. Something to piggyback off that too is that because I think this happens a lot of times, especially when in today's virtual age and people working remotely and not being in the same room with somebody and things like that. Is a lot of times I think people are apt to kind of what I call sort of hide behind your keyboard. And then they get into email discussions. That leads to conflict. If they would just pick up the phone and talk to that person and find out, hey, what's going on, or have an actual dialogue, that also is another way I think that alleviates conflict as well. So that's something I would definitely advocate for, is having that as much as you can, that in person, even if it's not in the same room, a live discussion with somebody, I think helps change the relationship such that you can dialogue through things together without having some of that conflict.
Yeah, and so much of so much of whether something turns into an actual conflict or it can be sort of extinguished is going to really come down to the frame that we have, or the perspective we have coming into it. And I think it's easy to assume negative intent with other people, because we're all kind of, as human beings, we all have this negativity bias. But if we can assume positive intent and remember what Jay said, which was most of the time, and in my experience, it's probably over 90% of the time that there's a conflict, it's due to some kind of misunderstanding, right? There's some kind of a misunderstanding. There's some piece of information that some party doesn't have, and inevitably the negativity bias starts to kind of fill in those gaps. So I'm just saying, if we can understand that conflict is an opportunity, and we can bring an assumption of positive intent with our adversary to that conflict, the odds of it flaring up are just greatly, greatly diminished. And Christine's had a great comment in here, and she said, saying things, I'm going to kind of paraphrase. Oh, here we go. Saying simple things like, that's a great question, keeps the communication more open so that folks feel like they're being heard. Again, to the extent that we can't, from positional authority, demand somebody does something, to the extent that true kind of authentic, sort of genuine participation in our agenda or program is what is most necessary or what's going to give us the best result, then we have to figure out a way to engage that person and activate them in an authentic way. Otherwise, they're just going to kind of pay lip service to it. They're just going to kind of go through the motions.
Yeah, absolutely. Yeah, I think, a lot of times what things I've kind of written about, or at least I've coached others on too, especially in this compliance profession type role, is that a lot of times you got to step out of your head and not think like, I would say, don't think like a compliance officer, think like an operational leader or a healthcare leader or a charge nurse or physician or whatever, just meaning seeing that from that particular person's point of view. And what is this going to be like for them to live with these rules or this regulatory change, not the person that's enforcing them. And that, I think, helps change that frame of mind to being open to what their experience is going to be, or what their point of view is going to be, and what insights and questions or challenges they can bring to the table that you need to address.
You know that saying, if it looks like a duck and it quacks like a duck, then it's probably a duck. So like, What does a duck look like? Like, I'm saying a duck being a business enabler. If we are here to enable the business, well, then how should we act? Well, we need to act that way if we want to ever move away from the caricature of us, or this sort of branding problem, this reputation issue that many of us face because we've stepped into a program or people think sort of negatively about compliance. If we want to break that mold and break out of this assumption that we're a business, stopper or something like that, then we have to act in a different way. And to your point, bringing that openness and trying to understand how I can get something unstuck by understanding what really that other party is concerned most about, I think is a lot more effective in terms of like driving change forward.
Yeah, absolutely. One of the things I've always been a big advocate for is compliance professionals understanding the business of their organization. And it's easy just to say, I know what the regulations are or aren't, or how to interpret words on the page and things like that. But if you can actually demonstrate to them, no, I know where the organization is in our market. I know what services we're really good at. I know what services we're not really good at. I know where our challenges come from recruitment or financials, or, in healthcare, big area is reimbursement, and what is our payer mix, commercial versus Medicare, things like that. And if you can know the business side of the organization, it helps tremendously with establishing rapport with your leaders, them seeing you as a business partner, not an obstacle. And that also helps when it comes to the point where you do need to work through that conflict, because you're going to have established a level of trust and respect from them.
And it's also going to show that like you can hang, to your point. Like, a lot of the complaints that I hear kind of secondhand from compliance officers with respect to kind of how the rest of the business views them is we're often viewed as like, we don't get it. We're just kind of throwing kind of like wrenches. We're throwing spanners in the works, as they say down under. We're throwing spanners in the works. We're throwing wrenches in the program. And we're kind of stopping folks from moving faster. And I think when we can come to those conversations understanding what actually matters, it's so much easier to navigate. Like if you know which way north is, well, then it's way easier to navigate versus, you just kind of wandering, through the organization. So let's go ahead. Go ahead, please.
Oh, no, I was just going to say, just to piggyback off that point, a big thing too, I see a lot of times challenges is just in the approach that compliance professionals can take. Not everybody, of course, I'm not talking about everybody, but those that kind of struggle sometimes with getting that reputation or having that perception in the organization and not being able to change it, sometimes comes to a self-awareness thing in how you're approaching the work. So for example, if you're doing audits or something like that, and I do a lot of work with rural facilities, so this is probably easy for me to use as a quick example, but in the rural hospital setting, a lot of times you have directors of departments that are also providing patient care because they don't have the staffing, the resources that a large metropolitan hospital is going to have. And so if you go in and conduct an audit, but you don't give them a reasonable amount of time to be able to produce the medical records or review the records or whatever, you give them, a very short turnaround time, and they're having to manage that plus patients and things like that. That's where it can kind of sting you a little bit and shoot you in the foot. So not to say you should give people, a huge runway to respond to you, but it does get down to how you approach the work a little bit can also help you, and just being sensitive and mindful of what they're dealing with, day to day with their jobs, in addition to having to respond to whatever your ask is.
Yeah. I mean, I don't think there's anybody in the world who thinks that they're stupid Everybody would say that I'm not a stupid. Everyone would probably say that they're like a good driver. Like I'm not a bad driver. Bad drivers are out there. And I think everybody also kind of assumes that they themselves are reasonable. And I think one of the worst things we can do is position ourselves or be thought of as unreasonable. And that's really what you're talking about. Like we're not saying no deadline or whatever, but I think we do a lot to damage our brand and we do a lot to damage our efficacy in terms of pushing change when our requests are viewed as unreasonable. And again, back to your point, many times if we're just kind of shooting in the dark without the context and without the understanding of perhaps how many hats this individual is wearing, then it's easy for us to be unreasonable, and it's easy for us to reinforce that stereotype that we are apart from the business instead of a part of the business, that we're the anti-business function versus the business enabler that we can and should be when we're firing on all cylinders and we're truly effective throughout the organization.
Yeah, absolutely.
So chapter 7 was one of my favorite chapters. And here's where you talk about the TKI negotiation framework. So before we get into this, we have a really special round of applause for Selena, our artiste behind the scenes. So if you like Ethico's takeaways and all that kind of stuff, let's get a little showering of emojis for Selena. She's got the best eye east and west of the Mississippi, frankly, best eye in the world. Anyways, we put together a one-pager taking some great takeaways from chapter 7, which is what we're going to be talking about right now. All Ethicsverse members get that for free, of course. That'll be sent around after. If you're not an Ethicsverse member, it's worth joining right now for free, so you can go ahead and get it. But let's dive into this TKI framework, because I think this gives some really good handles on the type of energy we should be trying to bring to these conversations. And it gives us also, I think, a good roadmap for when we're in kind of a conflict to kind of see which quadrant we might be in and how we can, move ourselves or move the conversation to the better quadrant. Okay, go ahead. Tell us about this TKI framework, please.
Yeah, so it's obviously not original to me. It comes from a couple researchers, Thomas and Kilman, and it's a conflict mode instrument that they had come up with, which identifies 5 different distinct negotiation styles. And so, and I kind of touched upon those in the book as sort of step 1 to navigating or trying to use diplomacy to resolve conflict. And what I was trying to do in the book was give folks a framework for how they can consistently work through any type of conflict, doesn't matter what the facts and circumstances are. But also noting that I did in the book a couple times that while I laid these out as sort of step 1 through 4, just sequentially, a lot of times the work's going to be done sort of in tandem. But the first step of it was trying to identify who you're dealing with from a negotiation style standpoint, what their personality is like. And and it's up there. And so competing, collaborating, avoiding, and accommodating, and then compromising is in the middle. And so how the model is set up is on the vertical axis, you have assertiveness, and then on the horizontal axis, you've got cooperativeness. And so it goes, further to the right or further to the top as you go along. And then this is where each of these different types of personalities fall on the spectrum. So, to compare and contrast, you've got the competing personality, which a lot of times is sort of the I win, you lose type mentality. And then you have the accommodating, which is you win, I lose. And then you've got others that are in the middle. And so I put those sort of taglines to kind of help identify where each particular personality lies on this particular spectrum. And one of the things I had advocated for in the book is earlier on in the book was setting up meet and greets and things like that. If you're new to an organization or if you're encountering a new leader for the first time, do facilitate introductions, get to know them, things like that. But a lot of times that can be beneficial for a number of reasons. And one of which is this, which is you can start to identify either in that meeting or as you go forward, you're going to start to identify what their negotiation style is. Are they more on that competing style where they would, and I should have mentioned this earlier, but where they would value more the substance of whatever it is that's at conflict over the relationship? Or are they more on the accommodating side where they just don't want to get into conflict and they just want to move forward? And they're valuing more the relationship over the substance. And
so cooperative, as you go kind of to the right, that's more relationship focus, and on the assertive on that y-axis, as you go higher up, that's more focus on the substance of the negotiation. Is that right?
Yeah, correct. And then the compromising and collaborating are going to be somewhere in the middle. where they're going to value both the relationship and the substance.
Okay. And so you were kind of talking through these steps. The first step is to kind of identify who you're kind of talking to and what their maybe default style is, or maybe what style you're kind of seeing.
Yeah, absolutely. And, I was thinking about this earlier when you were talking, when William had made the comment about the 360 perspective. A lot of times with these things, I think of them kind of like a puzzle, and you're just trying to find the corner pieces. And so this would kind of be an example of a corner piece. Just trying to figure out, where is this person at from a negotiation style? Are they going to be collaborative, easier to work with? Are they going to be more competing, competitive, that type? And then that kind of helps guide you to adapt or take that into account as you work forward and try to understand their point of view and find out what their negotiables and non-negotiables are, and then eventually come to a resolution. So this, I think, is a big corner piece that helps you kind of fill in that puzzle.
Yeah, I mean, you just need some kind of a framework to kind of get started, and kind of establish sort of where you're at. So I'd love to kind of get a little tactical with this sheet, because ideally I'm collaborative, you're collaborative, we get together, we care about the substance, we care about the relationship, and we're going to kind of figure out something together. That's probably the ideal. But if we're talking to somebody that's, let's say, accommodating or competing, or we think they're on sort of either of these ends of it, let's start with competing. How would you utilize some of these techniques that are in the book to come to a sort of satisfactory resolution without just like accommodating this highly competitive person? Because obviously in this framework, a competing person, when they win, you lose. That's not what we're going for here. So how would you sort of move someone who's in that competing end into kind of a resolution that's acceptable?
Yeah. So really the big part of it is going to be, the point of view piece, and trying to understand that point of view and where they're coming from. One of the things I talked about in the book was kind of differentiating between positions and interests, because a lot of times those shape a particular individual's point of view. And so to give an example on the competing side, that particular personality, let me back up for a second. On the positions and interests, the positions I define in the book is, it's what somebody says that they want, and then the interest is the why behind whatever it is that they say that they want. And so I used an example in the book of doing a billing audit, and we're asking a department director to conduct some chart reviews. And I think I called her Mary, and then Mary says, "No, I can't do this." That would be Mary's position. And then if I were to ask why, and she says, "Well, I've got 3 nurses down, 2 are out on leave. I'm short-staffed right now. I'm really struggling with time." That's going to be, and resources, that's going to be Mary's interest. And so the biggest thing to me that's been the most effective has been identifying that interest. It's not always easy, because interest oftentimes means somebody's going to have to share some vulnerability, and they may not be willing to do that. And you run into that quite a bit with the competing style personality. And so that takes a little bit of a finesse to it in working through it. In my experience, the most effective has been just to have an offline discussion with that person and find out what's going on, because a lot of times there's some type of fear, or there's another motivating factor that's going on, which is why they're so strongly opinionated about something. And so if we can try and identify what that is and see if there's a way that we can find a solution to appeal to that particular concern, or wherever that fear is, that helps in trying to get them more over to a compromising type mentality and working through some type of common ground for resolution.
So it takes kind of understanding kind of the why behind the what. The what is a no, I can't do that. The why is some kind of constraint or some kind of interest or some kind of focus elsewhere. And to your point, I think if we can kind of get past whatever that wall is and understand what that true interest is, quote unquote, that's preventing the action, then you might be able to get that unlocked. I think probably also, to your point, having that conversation in front of a bunch of people is probably going to fall pretty flat, because this this competing person is, you use the words kind of concerned or defensive or something. There's some kind of a wall up that's preventing them from being as accommodating or collaborative as we would like. So I think that's great. Let's go to the other end of that spectrum and talk about the accommodating personality, because I think with the accommodating, there's also like a different sort of bucket of risks that come along with that kind of a person.
Yeah, exactly. And it is similar with competing in the sense that there's sometimes something hidden that's going on, and you have to kind of pull that out or get to the heart of whatever that is. On the accommodating side, they're on the other end of the spectrum, which is they're more willing to not engage in conflict or just give up, whatever it is, or not be assertive or not be honest about whatever their true feelings are, or things like that. And sometimes that's where it can get into trouble. And then somebody is upset because, they didn't stand up for themselves and advocating for something, that they felt very strongly about. An example with the compliance and regulatory changes or something like that, it might be that type of situation where there's a new operational change and one particular department leader doesn't feel like it should be their staff's responsibility to have to make sure this document's in a medical record. I'm using a healthcare example, but you could probably apply it in other areas. And they think it should be the other department and their staff that should be responsible for it. But if it's an accommodating personality, they're less likely to speak up about it. And then they're going to get frustrated because now they've overburdened their staff more than they probably should have. And so that takes, again, a little bit of finesse and having some offline conversations and finding out what they truly feel about it and what's holding them back from verbalizing or vocalizing, what their interest is and why are they tending to be more accommodating and not be quite so assertive. So it's on the other end of the spectrum, but it's still the same thing in that there's something hidden there that you gotta uncover.
Yeah, and I think it's easy to get like what I would call false positives from highly, highly agreeable people. Like sometimes you meet somebody and they're just so nice and they're so agreeable. And this is kind of a corollary for accommodating, and you never really know what they actually think of you. You know what I'm saying? And then other times you meet people and they're very transparent and you kind of know where you stand with those people. I think this dynamic I'm talking about is kind of correlated with, or kind of a picture of, this personality aspect of agreeability. And so I would say if you're talking to somebody that is highly, highly agreeable, you just need to watch out for that false positive risk, because you might, they might pay assent, pay assent to your proposal and say, yeah, I'm going to do it. But maybe there's not that follow through because, again, something's hidden. And they're going to at least show that, hey, I care a lot about this relationship, and I'm going to sort of avoid making you feel uncomfortable because I, as a highly agreeable person, they usually have a high kind of EQ. You know what I'm saying? So they can sort of feel like, okay, I care a lot about this relationship. That's how they sort of acclimate to the world. And I just think that false positive rate is very dangerous. I mean, it happens in sales all the time. A salesperson will talk to somebody that's highly agreeable and they'll hang up and they'll be like, wow, that was great. I'm going to get this deal. And then it's like, no, you didn't get down to the issue. That person was just very polite. They were just very nice. Yeah. And so I think to your point, you were talking through those 4 steps. We've been talking a little bit about one of those steps being like knowing who you're negotiating with, knowing who that other party is. Look, you're not going to necessarily guess their Myers-Briggs personality type, but you can get some kind of a sense. Are they extroverted? Are they introverted? Are they, are they relatively more closed off, or are they very open-minded? Are they very agreeable, or are they very disagreeable, right? From a couple of those kind of, again, which means you have to have conversations with people. This is hard to, infer from a Slack message or a Teams message or, an email. But once you're kind of having those interactions, I think we can pretty much guess who's extroverted, who's not extroverted. We can pretty much guess with reasonable certainty how agreeable somebody is or how, open-minded they are.
Yeah, absolutely. And that's sort of where I was talking earlier in the book about the building strong relationships and things like that, getting to know others in the organization. It really helps because it should be fairly apparent to you kind of where they're coming from a negotiation style. Which
so
makes
I want
it
to
easier.
dive. It does make it a lot easier because, again, you're not shooting in the dark, and you're not, the worst thing we as ethics and compliance people can do is walk around with that, that golden hammer. You know what I mean?
Yeah.
Say, oh, well, we must do this. I mean, again, I'm going to keep coming back to this. It's all about voluntary compliance, and it's all about authentic compliance. Like, we're not going to have risk sensors throughout the organization who are willing to raise their hand. If those people aren't activated and they don't feel like it's their kind of active duty to raise an issue about those things, right? Like we have to tune into that. So we were talking about this position versus interest dynamic. I know we kind of touched on that a little bit on the last one, but I just want to talk a little bit about how, like, some tactics for trying to understand and gain a sense of this difference, because there's usually a why behind the what. And we're trying to kind of uncover, like, so much of conflict resolution and so much of, like, navigating any kind of political environment is understanding not the sort of facade reasons or the facade realities, but the true realities that drive those behaviors that, like, we're seeing. So I just want to kind of double click on trying to uncover those differences between, positions and interests, and some maybe different tactics that have been, that you've utilized in uncovering those and maybe different personality types.
Yeah, absolutely. To me, I think tactic-wise, the most effective one has been sort of that offline conversation, because it's a chance for you to kind of focus one-on-one with this person, talk through what's going on, have them speak to you without filter from the other side. You can have more of a longer format type discussion that you might be able to have in a meeting where you're trying to move through an agenda and you've got others in the room and things like that. That I think has been probably the most helpful, tactic in terms of trying to figure out what that interest is. Another one that I talked about, I think a little bit more in the understanding points of view, but it definitely applies, is doing department shadowing or department walkthroughs, things like that, where you can get in and really understand, and this is probably in the context of, again, a regulatory change or something that's impacting an operation, or it could be an investigation that you're doing or an audit. But if you take the time to go through and understand the department's processes, what the frontline staff are having to do, what the managers or senior managers are having to navigate and work through, what the work actually looks like from their point of view, that helps a lot. And sometimes those interests will just naturally come out as a byproduct of the discussion that you're having as they're explaining whatever it is that they're explaining. And in my experience, when I've taken the time to do this, it's really carried a lot of weight, because in terms of respect, because they're seeing, like, okay, he's willing to roll up his sleeves and come in and understand what's going on. He's not just going to tell me what the regulations say and we have to do this and that without my input or feedback or things like that, or he really wants to understand what we're doing. And so I always try to take a curiosity approach to that type of interaction. But the department walkthroughs, I can't remember if I mentioned this in the book, but I know I've talked about it in other spots. Several years ago, we were working on a new form that had to be put in place to meet a state requirement, and it was going to impact the registration staff that were in a hospital setting. So I went and registered patients for a couple hours with them and got to understand what the actual work was like. And then we were able to come up with a solution that was going to work. So taking approaches like that, I think, really helps in trying to identify what those interests are if somebody's not forthright and bring up that information, from the initial interaction.
So I would bet you doing that and helping those guys out probably achieved two different things that helped to drive that change forward. One, it gave you a lot of insight into the reality of it. And I'm sure that there were some changes to the plan, and I'd love to hear about it.
Yes.
But there was probably some changes to the rollout plan or how this form sort of worked after you got to actually experience, like, oh crap, that's not going to work. Or the realities of this workflow mean that, like, this, this new step or this new form that I built in the laboratory, so to speak, is not going to actually work, and I'm going to have to tweak it. So that's one that could probably fit into the workflow better. But I think two is a big one, is that there was a certain, I'm sure the people who were going to have to be using this form, just seeing you and just understanding that, okay, this person who's trying to roll this out is really trying to understand our work. It probably made them a lot more open to this change that you were trying to push.
Yeah, definitely. And not only open to that change, but then 6 months down the road, an issue comes up and they're more proactive to report it. Or speak up about something, because you develop that relationship with them that makes them feel comfortable and allows them to trust you. So to me, it was worth the time that it took to spend a few hours doing that, aside from my day-to-day responsibilities. I would do it again in a heartbeat, and I have done it in other areas too, but that, I think, has gained the most weight when it comes to tactic for this type of approach. And with that one, with the registration example, it was something. It was a software limitation, and it was 10 clicks to have to get to the spot where they're going to have to put it. And they didn't want to do that because they had to do this over and over and over while they got a patient sitting in front of them that's waiting to get back to the exam room. So we were able to find another spot within the medical record where they could house that wasn't quite so many clicks, and it was less of a hassle factor for them. And so, but again, it's something that wasn't said in the meeting when this first got brought up. And we wouldn't have uncovered
and sometimes it's hard to
that.
think through that in the meeting. And sometimes the person that's, actually doing the work isn't even in that meeting. And so, the representative of them doesn't know that, oh crap, this is going to take sort of 10 clicks. And again, this might sound trite, but the more work we can pull forward, the more persuasion we can pull earlier into our rollout plan for whatever, project we're doing, the higher the likelihood that it doesn't get off the track later. I mean, the worst thing is when you do this whole project and you come up with this plan and you come up with the new form and you roll the form out and you go, oh, okay, you get that dopamine hit from checking that or whatever, crossing that thing off of your to-do list, only to find out a week later that it's not going to work, or the data you're getting from this thing is not going to sort of solve the problem that you're trying to solve.
Yeah.
We have to balance that sort of that desire to close those loops and, that completionist drive to, knock stuff off of our to-do list with that sort of longer term focus to make sure that okay, as I check this off, it's actually checked off and it's not just going to rear its ugly head next week or next month when it's off track. And, something else that you said, I just think, the more we tend to, I think all human beings today, we tend to have these divisions in our mind, at least on a subconscious level, between our work lives and our home lives or our personal lives or something like that. Yeah. As our economy has shifted, and this is particularly true in healthcare, it's all knowledge work. And so it's all people, right? So any change you're going to push forward, it's not just changing some code in some software. It's going to be a process change that people have to actually adopt. And I just think the more we can meld those things, and this is kind of a lead into the next slide, but the more we can meld our personal, where we have friendships and we build these other relationships, with our professional, where the key to our success in many cases is dependent on the extent to which we're able to build kind of relationships with our peers. The more we can meld those things, I think the more effective we can be. And again, going back to your story, I think, there's a great saying it's something like, if you want a friend, be a friend. If you don't have any friends and you're in a new city, go find somebody who's moving and you go show up, help them move for a day, and guess what? You got a whole bunch of new friends. But your willingness to jump in and your willingness to help out is a great way to build relationships and to show that, hey, I'm kind of part of this team. And there was a comment like that in the chat. The more we can do to show that we're part of the team, the more we can do to show that we are reasonable, and we're trying to consider that other person, the more likely they are to adopt our, ultimately, the more likely they are to be influenced by us. Again, remember, people are the key to influence, the key to persuasion is two things. The other person needs to think, you like me and you're like me. And so again, going back to what I was saying, everybody thinks that they're reasonable. And so a reasonable person pushing change on me should understand what my life is like and what I'm kind of going through. And so again, having a quick conversation with a couple of people that are actually going to be doing the work or who are ultimately going to be affected, it's going to be super insightful for you, but it's also going to help you influence them in a much more sort of long-term way,
Yeah, absolutely. Absolutely. And, a lot of times, I'm just thinking about it, sort of another tactic is a lot of times things will come up and I'll see, okay, we have this new policy change or whatever, and it's going to impact this particular department. So then somebody I've got an established relationship with, I'll call them up and say, hey, this is what we're looking to do. What do you think about this? Or how is this going to impact you? Because I'm not clinical. I don't have a clinical background. I'm not doing the actual work, but I want to hear from somebody that's doing the actual work, what this is going to be like. And so even that, just kind of having that quick sort of conversation, again, to your point, it really helps develop those relationships and strengthen those relationships as you go forward.
So let's dive into this strategic empathy concept. I think this is a really smart concept, but I think a lot of people misunderstand it. This is not a sociopathic move here. Okay, this is what is it? If you're not teaching us how to be sociopaths, what are you teaching us with strategic empathy? Yeah,
it's really getting to understand the point of view, and where this particular person is coming from. And again, sort of back to what we were talking about with positions and interests and things like that. And how something is going to impact them, what their workload is like, what challenges they're facing, what motivations they have, things like that. So it's taking steps to really try and understand. We talk about things like walk a mile in somebody's shoes. I guess I sort of gave an example of that with the registration example earlier, but it really is doing things like that, or as much as you can, trying to put yourself in the position of whoever that person is, and how something is going to impact them, a compliance project of some sort. And then getting their feedback, both positive and negative. And, also trying to, I put this sort of, identifying some common ground and things like that, of where can we find some common ground that we can all work towards, and are there areas where we might both be empathetic towards the same particular goal. In healthcare, it's super easy because especially if you're delivering patient care within your organization, because everybody wants to take care of patients and do the best thing or the right thing for the patient. So that's a pretty universal goal that you can, latch onto depending, regardless of what background you're coming from. But
to that point, it's also kind of table stakes in a lot of ways. And so if you're not engaging in this sort of strategic, empathetic approach, particularly in healthcare, where that's kind of foundational, right? I mean, that's a sort of a common sort of value, then you're going to stick out even more. And the odds of you falling into that sort of stereotype and, exhibiting behaviors that reinforce that stereotype, which obviously all make it harder for you to do your job, to de-risk the organization, to push the change, to improve your program, whatever, all those things are going to be, it's going to be a lot harder to do that. Why is this such a hard thing for folks, do you think, Jay? I mean, for some people it's so natural, but I've just seen a lot of folks really struggle with this, and they're like scratching their head like, man, my program looks the same like it was, as it was 5 years ago. Why are none of these initiatives, moving the needle?
Yeah, I'm sure there's probably a number of reasons. What is kind of standing out to me, just sort of from things I've seen or experienced, over the years, trends wise, is it's that challenge of vulnerability and self-awareness are things that oftentimes you have to overcome in compliance, to be willing and open to hearing that feedback and getting an earful from somebody operationally that this is never going to work, or, this is going to cause, A, B, and C problems or whatever. Sometimes people just want to work through and just get to the finish line with it. And so you have to be willing to be open to negative feedback a lot of times. And, I know, at least for me, that's been certainly something I've had to overcome, as I've gone forward with, hey, we didn't do, education is probably a good example, where we had a regulatory requirement come out and then we didn't do a good enough job of staying on the message because we had staff turnover, and then somebody new comes in and they don't know what the requirement is. And so things like that, we had to take a hard look and go, you know what? We really did kind of a one and done here on this education. This really needs to be hit home consistently and often, and we need to account for staff turnover. Or another area that's challenging sometimes with compliance folks is the density of the information. It's very complex stuff we're dealing with, and having to communicate in a way that makes sense, A, can be a challenge, and then B, in a way that they're going to remember. And so a lot of times you have to be pretty self-aware of how you're communicating a message, and is it landing with your audience? And if it's not landing, what's going on there with why it's not sticking, and is it something that we're doing? And I know sometimes that's hard for people to hear.
Yeah, but I feel like we need to have a little empathy for ourselves and have a little grace for ourselves, because while we are, I think there's probably a higher rate of like perfectionists in compliance than in, the average other kind of role. And so that perfectionist drive is both like an opportunity and a threat. It's a superpower for us, but it also can be kind of detrimental in some ways. And I think if you can have some grace for yourself and recognize that, like, there's no silver bullet, there's no plan you've ever done that's gone totally perfectly. There's no thing that you fixed that didn't have to be refixed later. Like, even if you build a brand new house, at some point the gutters are going to break. At some point, something's going to need to be worked on, right? So like, if we can recognize that no loops are actually ever closed. Sorry to ruin this for you guys, but like loops are just temporarily closed. And like the odds of you threading the needle perfectly across this dynamic, complex organization, the odds of you having perfect consideration for all these different things is zero. So the odds are you're going to have to rework it. The odds are circumstances are going to change, or regulation is going to change, and whatever. And I'm just saying, if we can move away from this destination thinking where we're like, okay, great, that's done, and rather enjoy the process. We were just talking about this, me and Leslie Bowles, who you guys should check out on the Ethics Experts. We were just kind of talking about this. We have to fall in love with the process and not the outcome, because many times we can't control the outcome. Many times the outcome changes as a result of some kind of exogenous factor that we can't even control. But if we can fall in love with the process of continuous improvement, and then as when we get feedback that something we were trying to roll out is not right, it's not the end of the world, and there's not the wringing of hands and the gnashing of teeth. It's like, okay, cool. Well, I just have to kind of rework this a little. And so I'm just saying, if we can change our perspective a little bit, focus more on those inputs, then that harvest is going to take care of itself. And you know what? Every job is hard. Compliance is a hard job, right? We carry the weight of the world on our shoulders. Many times it's a lonely job. Many times it feels like we're pushing, we're Sisyphus pushing that rock up the hill. But I think if we can fall in love with the process and understand that our incremental gains are going to come just in that way, in an incremental nature, then we're not going to, it's not going to feel like the world's falling apart every time we get some of that feedback, or we have to rework a policy or redo that training. So.
Yeah, absolutely. I completely would agree with that. And I love the stuff that Leslie puts out. And as you were talking, something that also was making me think about with the process is, and it's something I touched upon in the book, is, a good barometer for me with this particular profession and why I've stayed in it as long as I have is because I have an unconditional love for the struggle, which is weird as that sounds. And I used a reference to skiing because I'm in Colorado and I love skiing. I've always loved skiing, but not everybody loves skiing. It's super cold. You got a runny nose. You putting your foot in an uncomfortable ski boot. You got to love those things in order to love skiing. And so I have the same thing with compliance stuff and reading very minuscule font in the Federal Register, or trying to work through a very complex issue that involves several departments. And I just love working through that, like you said, process, or like Leslie said, process and struggle. So that's, to me, always been a good barometer if you're in the right spot from a profession standpoint.
So again, and one other point I want to make about strategic empathy, look how this is defined. Demonstrating empathy shows understanding without necessarily indicating agreement. So you don't have to actually sympathize with them. This can be more of a headspace thing. But again, it's about making somebody feel heard, and it's about you gaining the actual understanding with respect to the interest behind the position. Okay?
Yeah.
Okay, let's dive into this next one, identifying common ground. So again, I see a lot of otherism in organizations. Otherism is bizarre. It happens in in the bedroom of twins who have that tape running down the middle of the room. And it's very, it's crazy how quickly otherism creeps up in an organization. It doesn't even have to be that big for these little sort of, tribes to start sort of forming within, beneath the umbrella of the company. So how do we fight against that sort of, innate thing within all human beings to like fall into this otherism trap and really find common ground with someone that we might be kind of going head to head with or trying to get unstuck?
Yeah. So to me, the starting point has always been sort of those universal points of agreement, that we had listed there. Patient care is one. Another one is, what is the risk to the organization? What in healthcare, what's the risk to patient care? What's the risk to the organization's reputation? Financial risk, strategic risk, reputational risk. A lot of times those are all concepts that everybody can get behind in finding common ground of wanting to do the best thing for the patients or the care delivery professionals or the organization. And so if there's a way you can find common ground through that, and how whatever thing that you're working on where there's conflict can support that, that's at least a good place to get kind of a foothold.
Yeah. And I just think you have to know in your heart, like at the core, there's always some common ground that you can find with someone. If nothing else, we can just connect on our humanity. You know what I'm saying? Yeah. Like, you're a human, I'm a human. Okay. So like, we all go through kind of this humanity experience. We go through the struggle, as you said. There's always something to connect on. I just think a lot of times, maybe people fall into three buckets. Some people are great at finding the connection. Some people kind of find it, if it happens, and others are like not even really looking for it. You can always find the connection. There's always something that you can connect with. And again, in healthcare, patient care can serve as this universal point of agreement in this setting. And so you got to find a way to overlap. Like, how do I make you care about what I care about? Well, I have to put it in terms, I got to speak your language, and I have to put it in terms that you can see how this benefits you or how it benefits something that you care about. I mean, that's kind of what the key is here, right?
Yeah, absolutely. And it's something I didn't realize when I first started out in healthcare, but it took a few years where it sort of hit me over the head. And that was realizing that, and this kind of goes back to what we were talking about with empathy too, is in healthcare, we're sort of spoiled in that patient care is an easy area for us to have empathy towards or find a universal point of agreement, because every one of us at some point in our lives has been a patient or will be a patient, or we have a mother or father or son or daughter or other family member that's a patient. And how would we want that particular person treated, or what would we want their experience to be if they're coming through our particular organization, has always been kind of an easy thing to latch onto. And I think you could be I think I said other examples, but you could be a car salesman, for example, and not have a driver's license or never drive a car. It's a little different in some of the other industries, but patient care and healthcare is one where I think we kind of get spoiled in having that component to it. And so that's something, again, I think is a good, quick spot where you can usually find some common ground.
Yeah, I mean, but also I will say, I've also seen a lot of us take that for granted and not utilize it. Do you know what I'm saying? Like, it's almost like it's just so apparent. It's like we don't use it, but it's right there. It's right there for us to use. It's right there for us to frame what we're doing in the context of this thing that everybody cares about. I mean, again, like if you look at healthcare, a lot more people self-select into healthcare, who want to make a difference, who want to leave the world better, who care about other people, right? And that's not just compliance people. Those are people throughout the organization. So again, we have to use the things that are available to us, and we have to look at the things that are available to us with fresh eyes. Otherwise, it's easy for them to get sort of, lost on the wall, so to speak.
Yeah. Absolutely.
So we're coming right to the end here. I want to talk about this value exchange resolution and the importance of it. So why don't we dive into that? And then I want to leave a quick minute to talk about this Thursday's episode. And I also want to make sure that everybody got the QR code for your course. Okay. So let's run through this value exchange resolution together, and so that we can all understand the importance of it in the context of conflict resolution and navigating politics.
Yeah. So this is just making sure, as you're finding common ground, and this gets back to accommodating styles and competing styles and things like that. Hold on for just one second.
Man, phenomenal.
Okay, sorry about that. I'm just getting over.
No, all good. Phenomenal comments in the chat. There's so many I wasn't even able to get to.
I could feel something was coming. And that is just making sure that if, as you're trying to come through a resolution and find common ground, a measuring stick or a good barometer to use is, or guidepost is making sure that if somebody's giving something up, they're getting something in return. And then that way it's not such a lopsided exchange. And a lot of that can come out as you're working through some of the earlier steps where we're obviously identifying the parties. We're spending time understanding their point of view. We're trying to figure out what their negotiables and non-negotiables are and what is their walk-away point, things like that. Once you get through those steps, you should be able to be in a position where you can find some common ground and also identify, okay, what is something this person's willing to give up in order to get whatever it is that they want, and trying to make sure that you can balance that out.
I mean, think of yourself, right? Like, I don't know, I'm somebody, I got to feel like I'm getting a deal. Mm-hmm. I'm somebody who I don't want to feel like I'm losing, I don't want something imposed on me and I don't feel like I'm getting something. Yeah. And so I just think, a guy's got to feel like he's getting a deal. And so if you're putting something, you got to give him, if you're putting something on him, you got to give them something else to kind of balance that out. It's just human nature, because the worst thing that can happen, again, we were talking about this a couple minutes ago, the worst thing that can happen is they pay you lip service. Okay, yeah, I'm in. In the back of their head, they feel totally ripped off. They're going to recoup that remuneration at some point. They're going to figure out a way to get back what they're getting, whether it's kind of just, a half-hearted, compliance, right? Like there's 100 different ways that someone can like get back and like even the scales. And I think we have to tune into the fact that we're dealing with other human beings, and it's easy to put ourselves in their shoes because we know how we would feel in that kind of a situation. So again, I think a little bit of this and a little bit of focus on this value exchange helps us maintain that, that team mentality where I'm not just like a parasite on your day-to-day work. I'm someone who's actually helping you get your work done better and faster and safer and, less risky, et cetera.
Yeah, absolutely.
All right. So give us a little rundown on this. I did not pay this enough. Tell us about this course, guys. The QR code is here. It's really phenomenal, but walk us through it, please.
Yeah. So the course was something I'd launched a couple months ago, and it was really designed. I mean, I was working on the idea of it when I was finishing the book a couple years ago, and the intent of it was to be something that was a little more kind of brought to life a lot of the concepts that I covered in the book. So it's supposed to be a companion to the book. So it does cover some of the same strategies that we talked about in the book, except for it doesn't have quite the political or office politics slant to it. And it also covers things I just wasn't able to do in the book. So there's templates and things like that to help with some of the communication. There's some other tips and FAQs and things like that I just didn't have the opportunity, or there just wasn't a way to make it work in the book. And so it's really designed to bring to life a lot of the things that were in the book, bring up some more real world examples and things like that. I also set it up so that when people do sign up, they've got lifetime access to it. So it's not just kind of you attend once and that's it. It really was designed to be, okay, selling compliance is hard to leaders. How can we do this in an authentic way that's not selling quote unquote compliance? And so it is about the building relationships and the communication and buy-in. And so, like I said, in a lot of ways, it's a companion to the book. It just goes into a little bit more in depth into certain areas.
So check out this course. It is really good. It really addresses this thing that I think a lot of us struggle with, because it's all about influence. And it's all about getting that buy-in kind of up and down the stakeholder stack, right? Leaders, people on the front lines, middle managers, et cetera. So we just kind of scratched the surface of this book. Definitely check the book out if you haven't yet. Navigating the Politics of Healthcare. And this Thursday, I wanted to mention, we are going to be going through the Chief Compliance Officer Survey. So Ethico and FTI partnered. We got hundreds of responses to this global survey about chief compliance officers, and we're going to be diving into the findings. So if you're an Ethicsverse member, you should have already received an early copy of it. The thing is coming out in a couple of days, I guess. But yeah, check that out, and definitely come on Thursday, because we're going to be diving deep with the one and only Angie Gorman. Let's get one more round of applause for Jay. Jay, thank you so much for joining us. Check out Jay on LinkedIn. Check out Jay on Amazon. Grab this book or swing by our booth at the next conference and pick one up. Thank you guys all. Love you all. See you on Thursday. Take care.